Thank you very much. My presentation is an article review, and the title of the original article is How Informed is the Consent in Vulnerable Populations? Experience using a continuous consent process during the MDP 301 vaginal microbicide trial in Mwanza, Tanzania. The article was done by Valley and the colleagues. So the summary, this is a review of an article authored by Valley and colleagues published in BMC Medical Ethics Journal in 2010. Okay, the other one I've already stated. So its main aim was to investigate the effectiveness of continuous informed consent process adopted in the MDP 301 vaginal microbicide clinical trial. The aim of this review is to critique the technique and the contextual contents. The review will also provide a conclusion of the article, and it will also give some of the latest knowledge about the same topic. The problem was the unique ethical dilemmas of HIV prevention, clinical trials in vulnerable, at-risk populations in developing countries. So this one is to check the validity of informed consent in such settings and socially vulnerable groups reported to be associated with reduced comprehension and retention. So this research was aimed at trying to see if these populations, because of their social status, if the research is validated or the informed consent is validated because of the reasons given. So the method that was used was, there was a random selection of 102 research participants, and in-depth interviews were conducted. The data was analyzed using a qualitative tool, QSR, NVivo software, and thematic analysis were employed to analyze the results. The research design was not given in the article. On the results showed that the majority interviewed participants showed evidence of having understood and retained key research messages. Interventions to aid participants understanding, such as engagement of community representatives and participatory community liaison systems, among others, showed positive results. So among the mechanisms that they had devised was to make up small groups that will monitor how the consent form process was going to be moving, and they engaged community members and they trained volunteers to help in the continuous process. Despite low levels of education, most women showed good comprehension and retention of important information. Despite evidence of good understanding among participants, the authors noted that it's not clear to what extent the choice of participants was based on. The author further argued that good partnership created may have led to therapeutic misconception. So, according to my analysis, the article was well structured. The article was peer-reviewed, and the author was internationally acclaimed, hence it has authority. There is accuracy in the contents or other recent publications that are referred to in the article. The article displays elements of objectivity, stability, relevance. Subject matter is also of current interest. These are some of the references that I used. So in conclusion, the article has contributed vital information on the use of informed consent process strategies to enhance participants' comprehension and retention of key research information. The article was well presented and displays rich scientific content. The reviewer of the primary article is currently in the process of conducting a project in investigating participants' experience and opinion on the informed consent. This is the end, but basically, in summary, the article, this article was based on looking at other means of how patients can consent instead of the traditional way whereby patients will consent at once and then the research is done for a long period without reviewing how the participants are retaining the information. So in this study, they made it that they conducted this informed consent in about 3 phases, at 4 weeks, at 24 weeks, and at 52 weeks, to follow up on how the participants retained the information. Thank you for listening.